This is the MedStar Washington Hospital Center Cardiac Cath Lab Risk Calculator produced by Eileen Searson and Dr. Hank Rappaport. This risk calculator is a secure website which allows a clinician to insert information on the patient, basic demographic, current clinical, and past clinical history information to calculate mortality, post-procedure bleeding, 30-day readmission, and contrast-induced nephropathy risk scores. This calculator is based on algorithms found in the following articles. Brennan's 2013 JACC article titled Enhanced Mortality Risk Prediction with a Focus on High-Risk Percutaneous Coronary Intervention. Rao's 2013 JACC article titled An Updated Bleeding Model to Predict the Risk of Post-Procedure Bleeding Among Patients Undergoing Percutaneous Coronary Intervention. WASPI's 2013 CIRC article titled A Prediction Model to Identify Patients at High Risk for 30-Day Readmission After Percutaneous Coronary Intervention. And lastly, Moran's 2004 JACC article titled A Simple Risk Score for Prediction of Contrast-Induced Nephropathy After Percutaneous Coronary Intervention. Now I'll show you how easy it is to insert the data in order to get risk scores and the visual risk score above. It's very important that the clinician inserts all data in order to get as accurate as possible of a risk score. We believe that this risk calculator is a helpful aid helping the clinician with their clinical decision making. Now I'm going to calculate the score. As you can see down here, the raw risk scores below and graphs indicating the risk score above. These are color-coded with universal colors, green meaning good or low, red meaning high, as well as yellow scores indicating moderate risk. In this case, this patient doesn't have moderate risk for any of the four indicators. For mortality risk, it's low. For 30-day readmission, high, post-procedure bleeding, high, and contrast-induced nephropathy, high. Here is a picture of one of our clinicians using this risk calculator in the cath lab. We find this to be a valuable tool and believe that other cath labs may find this to be valuable to help them with clinical decision-making as well as test the algorithms for their patient population.